Hi, my name is Brad Anderson. I'm a second-year internal medicine resident at Mayo Clinic. My co-authors, Dr. Andrew Greenland, Dr. Laura Greenland, and I have completed a manuscript entitled Facial Hair, a newly identified modifiable risk factor in home oxygen therapy-related burns, which will appear in an upcoming issue of the Mayo Clinic Proceedings. We were inspired by 3 patients who presented over a 4-year period of time to the primary care internal medicine clinic at Mayo after sustaining facial burns while on home oxygen therapy. We were particularly impacted by the emotional as well as the physical impact that these burns had on our patients. In discussing the case with the patients, we identified a common physical attribute between these 3 gentlemen in that it was noted that they all had facial hair at the time of their adverse event. Upon further review of the existing literature, we were surprised to see that facial hair has not previously been pursued as a risk factor or studied as a risk factor in the setting of home oxygen therapy-related burns. This prompted us to review our own institutional experience with home oxygen therapy-related burns, in which we identified 9 male patients. 8 of those patients, or 89%, had facial hair at the time of their adverse event. This led us to hypothesize that facial hair is perhaps a risk factor for facial burns sustained while on home oxygen therapy. To test our hypothesis that facial hair increases the likelihood of facial burns while on home oxygen therapy, physical models were constructed both with and without the presence of human hair mustaches. These modeling studies were performed with oxygen flowing at 2 liters per minute in each scenario, and models were exposed to a spark source. We demonstrated that in the presence of facial hair, the model and nasal cannula readily ignited. In contrast, without the mustache, ignition was not achieved, strongly suggesting that facial hair increases the risk of home oxygen therapy-related burns in the presence of an ignition source. With the increasing prevalence of home oxygen therapy, this finding has very important implications to clinical practice. Burns related to home oxygen therapy are potentially life-threatening. Healthcare providers have an opportunity both at the time of oxygen therapy prescription as well as at follow-up visits to provide their patients with strategies to avoid at-risk behaviors while on home oxygen therapy. Through enhanced provider awareness, patients may work with their provider to employ strategies to reduce the risk while on home oxygen therapy, such as smoking cessation, eliminating the presence of facial hair, as well as avoidance of activities associated with an open flame or spark creation. We hope that these findings, in conjunction with enhanced provider and patient education, will help to reduce the incidence of home oxygen therapy-related burns.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.